Exam review. What I just want to say to you is that it's 50 questions, um, 2 points apiece. On my exam review, you are not required to be on camera, so keep it off if you want to. Um, I will keep my camera on. I do a PowerPoint that I do not share with students because it's not published, but I use it to sort of guide you guys for the review. You guys should all have access to a review sheet. Your teacher should have gotten that out to you. I hope they did. Did they? Yes, hopefully. Okay. If not, contact your professor. And we'll go over some topics tonight. I go through this very directly and pretty quickly, and the reason for that is because you guys don't want to sit here and hear me lecture. But what I will tell you is that what a lot of students do that are successful is that they listen to the recordings over and over and over again, and you'll start to see trends in the recordings, meaning what I teach and Dr. Lundy teaches, probably around the same concept. Okay. So if both of us are addressing it, I'd say know it for the test. Right. So that's where we start. So 50 questions, there will be 5 math questions. For these exams, you guys need a whiteboard and they do not want you using paper. Okay. So for the HESI, you can't use paper, and for our exams, we make it so that you don't use paper. Okay. Um, you won't have a calculator either. So I think there's a calculator on Exemplify or whatever. Usually, and if this changes, then ignore what I'm about to say. Usually you'll get a practice exam before your test to make sure that your computer is aligned. Yeah, I know. So just give me some time. I haven't opened it yet, Jamie. So you'll have an exam like that you take beforehand. It's like silly stuff for like 10 questions. So you want to do that beforehand, make sure your computer's working, you know. And if you have any problems, Exemplify's phone number is out there. I will give it to you right now. If I were you, I'd put it in your phone. Because if you have any problems with the download or anything like that, then you want to definitely call them. The number is 866-429-8889. Okay, so that'll help you for any problems with the download, the practice exam, whatever. And that's it. So I'm going to share my PowerPoint, and the reason I use a PowerPoint is because I just like you guys to look at something. And so when you're listening to this recording, you'll hear me say certain things off the PowerPoint. I can ask for your input sometimes, but sometimes people don't answer me, so then I just move along. All right, so when we're looking at a community, we know that population health is the health status of a defined population of individuals. We know that there's a distribution, right? There's healthy people, there's sick people. So when we're looking for an evaluation in the community, we're going to look at the health status of our patients. What is their knowledge? What kind of preventative stuff do we have going on? Playgrounds. We have lights in the streets. Do we have driver programs for new drivers? That's always a worry with our teens who start driving. Do they have sidewalks? So we look for all these things in a community to tell us more about that community. Okay. We take a look at patient rights. We're going to think about what ethical issues come up related to abuse and screening. Please remember, you guys are mandated reporters. You do report it, you do not hide it. We know that unless the patient is declared incompetent, the patient should have the right to self-determine, which means take care of its own finances. So we talked to my class about abuse on our elderly. We want to make sure that with our elderly, we're maximizing their self-care capacity. What they can do, they take care of themselves. We help them manage chronic diseases effectively. We prevent complications. We help them achieve high quality of life before the end of life care. Okay. We have 2 separate types of nursing that we talked about this week. The primary focus of community-based, I want you to remember the word base, is the care of ill individuals and families across lifespans. So what we think about is our base, our group of people, and what they have wrong with them. Okay. Then community oriented is going to be, we look to evaluate the risks of individuals and families, but we're looking more like healthcare on the healthcare of the individuals. And that's our primary focus. Okay. Community-based again is going to include our chronic conditions. We look at 3 levels of prevention. Please know them. You will have probably 3 or 4 questions on this. So you have your primary, and so we say we prevent with our primary prevention, right? We prevent things from occurring. Then we go to our secondary, which is our screening. And that's going to be, we're checking out people to try to minimize the impact of an illness. And then tertiary is treat. So can somebody give me an example of a primary prevention?
Diet and exercise.
So diet and exercise would not be primary prevention, but
Vaccinations.
teaching about exercise and diet is great. So the teaching would be the prevention. Vaccinations for sure. What else? How about our colonoscopies? Where's that fall?
Secondary.
Yep. Our self-breast exam secondary, our colonoscopy secondary, our pap smear secondary, our hemoglobin A1C secondary, right?
Yes.
All that good stuff. And then tertiary, you have to have some condition. So this is how I teach this, and please remember this. You have to have something wrong with you to be at the tertiary level.
Diabetes.
Okay? Anything. You could have anything. So teaching a diabetic about insulin management, where would that fall?
Tertiary.
Good. Teaching a patient with osteoporosis about dairy intake, where's that?
Also tertiary.
Yep. These all have conditions. If it was a healthy person doing a hemoglobin A1C on a routine medical checkup, what would that be? Routine medical checkup.
Secondary.
Yep.
Secondary.
So hemoglobin A1C, you'll get that as a screening, right? See how your sugars run for the past 3 months. All right, so think about, I want you to remember that smoking in children with asthma, that's a big problem, right? It's going to aggravate it. We're going to have to do some primary and tertiary prevention here. Public health focuses all on all of this, disease prevention and health promotion, okay? Very important to remember. We have 2 types of insurance in the country that we currently live in. Who knows what's going to happen, but that's what we have now. We have Medicaid, which has the word aid in it, and we have Medicare. The way I like to remember that is you're caring for your older people. So Medicare is 65 and older. It's increasing because our baby boomers are about 75 to 85 right now. Medicaid helps those with low income and those who are unable to work. We have private care, and we have public care. There's a difference between the two, and I don't think you have to know this yet, but I will tell you the difference anyway. In order for Medicare to reimburse for nursing personnel, they have to have something wrong with them. So they're not going to send somebody home and pay for like a babysitter. That would only be under Medicaid, okay? We look at our Affordable Care Act. This was passed by Barack Obama to allow help and help Americans access health care. What did they want to do? They wanted to increase those who could afford it. They wanted to increase quality and lower costs. We know that in the US, we spend a ton of money, but our indicators are not great. Okay. So just remember that when you're thinking about all this money that we spend. What else do I want to say? What's happened with the American Health Care Act? Know that companies have a higher rate of insuring their people. That's really what came out of that. There was more to it, but it didn't work exactly the way they wanted to. But we're always constantly working on it. School nursing. What do we know about school nurses? We do all kinds of stuff as a school nurse, right? We think about things like obesity is always a concern. What do you think is going to be our priority if a kid comes into the office? What's the first patient we're going to see? or worry about?
Patient with a breathing issue.
Very good. Airway. So what's that going to be? That's going to be your asthmas.
Asthma.
You can't breathe. If they have a limb falling off, that might be more important. That's bleeding, right? But we always think of airway, breathing, and circulation, right? We're not going to worry about lice really, and they don't recommend sending kids home from school from it because it passes through pillows and hairbrushes and stuff like that. So we wouldn't necessarily send a kid home. But remember, anytime you're asked, airway, breathing, and circulation always trumps everything else. Okay. We see a lot of stomach aches. We see a lot of pink eyes. We see a lot of asthmatics. When we take a look at our patients, we have things called the genogram, which looks at the genetics of their family, G for G. And then we also have ecomaps, and those ecomaps are going to provide information about relationships that they have, right? So how do they all interact? And why does it matter who you're interacting with?
For communicable disease.
Could be communicable
Possibly.
disease. What else?
Make sure it's not your cousin.
Environment that
Tell
they're
me
in,
what you mean.
like cleanliness, or whether the people are safe to be around, or
Yeah, you're worrying about what are they around and what are they being exposed to, right? We talked about rural communities in my class and how the level of acuity of hospitals is minimal in these rural areas, and people worry about what everybody knows in their community, so you're gonna have less reporting of things, okay? So be careful about that. Healthy People 2030 in schools, we look to increase our vaccinations. We look to reduce the number of school days missed because of things like asthma, because they can certainly come to school with their inhalers, right? We have a couple acts that we want to remember with public health, family and FEMLA, which is Family Medical Leave Act. So if somebody's sick in your family, you can take off and you're guaranteed a job. I don't know how long that goes for. World Health Organization helps regulate worldwide events like pandemics. We have our American Disabilities Act, and that was that act that was passed in 1990 and protects against discrimination of people with disabilities. And then QSEN, our Quality and Safety Education for Nurses. Please know this is not federally moderated. Quality and safety for nurses looks like with quality improvement, evidence-based practice, patient-centered care, and safety. We have evidence-based practices, which is what we're going to focus on. So we use the best evidence in making decisions about the care of individual clients. We're going to look at all different types of studies, no matter what is supported, what counts as evidence has been the hierarchy. So we look at ranking in order of decrease, importance, and use. We see that like stuff like anecdotal and expert opinion is not as valid as our systemic reviews, where they have a bunch of people, you look at all the studies that have been done. That's way more. Please know the different types of studies. You have non-randomized, you have quasi, case controlled, and qualitative.
For that section, evidence-based practice, I see on this study guide that there was a bullet point, the steps of evidence-based practice, 7 steps. It starts with inquiry. Are we needing to know that as well?
I mean, you should know it, but it's not something I would recite, memorize.
Okay.
You just know what you do when you're doing evidence-based, what we're doing with evidence-based practice. Why would a nurse choose public health? There's a lot of autonomy and a lot of independence. What is a medical home? Does anyone know what a medical home is?
Would that be your long-term facilities or
Mm-mm.
no?
Mm-mm.
There are resources.
A doctor that holds the patient records and coordinates patient care.
Exactly. It's the doctor who holds all the records and coordinates care. Why is that beneficial?
Continuity of care.
Yeah, to make sure that somebody's got all those records, so if something happens and you need to get them together, you can call the doctor, he'll have all of them. I don't know why that slide's in there twice. Social determinants of health are the conditions in which people are born, grow, live, work, and age. They include factors such as economics, education, neighborhood, physical environment, nutrition, stress, employment, social support networks, and prejudice, as well as access to healthcare. We know our largest impact is economics, the higher chronic disease and less follow-up with vulnerable populations. Income and social status, the higher the income and social status, they are usually associated with better health, but not always. But definitely low and low go together. Low education is linked with poor health, more stress, and lower self-confidence. Physical environment, we need safe water, clean air, healthy workplaces, safer homes, all contributing to good health. Our social support network, our family, our friends, our community, our traditions, all going to impact our health. Genetics as well as behavior and coping skills. Our health services, what do we have access to and do we use it? And gender, men and women suffer from different types of diseases, as we know, at different ages. And so this is something that we look at when we're looking at our vulnerable populations and our disparities, okay? Things to remember. A vulnerable population is our subgroup of population that is more likely to develop health problems as a result of exposure to risk. So we think about our homeless population, we think about those people living in countries like this, right? And so these risks come from environmental hazards, social hazards, personal behavior, and biological or genetic makeup. Okay. Any questions? Vulnerable populations, you guys are going to find a vulnerable population in week 9 and do some research in your community, find out about them. So it'll be really great fun. You're going to be pros on vulnerable populations. All right. What does public health do and why do we care? Primary goal is going to be prevention of disease and disability. Promotes independence with the nurse and autonomy. As I said, a public health nurse has a lot of autonomy. Public health nursing has a population-focused practice, right? We help to understand the problems and solutions of a defined population. So we identify subpopulations and what's going on with their increased risk. Leading cause of mortality has shifted to chronic diseases. Increase in the number of older adults and increasing population has created a challenge for us as public health nurses. The population of the world is increasing due to our increased fertility rates, but decreased mortality. People are living longer. We have advances in health care, including vaccines, screening tools, and medication. I am going to re-emphasize our biggest health disparity, largest impact is economics. Okay. We keep going, our Healthy People 2030. What is it? It's proposed by the government. It's to keep us increase our health equity and their social determinants of health. We're going to set national goals. What are we setting goals for here? We're going to try to get healthier lives that are free of disease, disability, and injury. They create healthy social, political, and economic environments, healthy behaviors and well-being. And leaders, we want them to become involved to help make us some policies that are going to help us. We had a whole chapter on family. I want you to remember, please, that family structures have changed over time. There's no right model of a family. Each family is unique, and it's up to the patient to determine who is the family. So it might include grandma and grandpa. It might include mom and dad. It might include dad and dad. It might include dad and stepmom and stepdad and mom, right? There's so many different options here that I just want you to remember that. So what are characteristics of a healthy versus unhealthy, functional versus dysfunctional? There's a chapter in your book in that chapter, and it will tell you right there what we define as healthy. It's really spending time together, communicating with one another, being involved with one another. Think about how we delegate and prioritize when we're looking at families. What is a family crisis? We know a family crisis is when a family is not able to deal with something that has occurred. They'll say, I can't do this. This happened, I can't do it. Okay? And we talked a bit about our genomes and our ecomaps. So this is a re-emphasizing there what they are. Genomes, genomaps are genetic, ecomaps are about our environment. Home visits, we want to make sure that we're taking our time and we're establishing trust. We don't want to just go in there and take over. We always have to establish and assess the environment and resources. Always stay safe. Before the assessment, please make sure you're reviewing what is being assessed and why. What's a good time to visit the family? What's the purpose? And try to have the whole family there. Why? Why should we try to have the whole family there?
So you can have everybody's input.
Yeah. And see how they interact with one another. See who's the caregiver. Sometimes the kids are the caregivers, right? Sometimes the little people are taking care of the big people in the house. All right, we look at risk assessments, young child, gun safety. What are we going to make sure these guns are done? Either remove them from the home or keep them safe in
Lock 'em up.
storage. Go ahead. Did someone
Oh, I
say
just
something?
said lock them up.
Yeah, lock them up. Absolutely. That's right. You lock them up and make sure that we're not mixing substances with possession of a gun. If you have something that's working on the central nervous system, what are you going to be worried about if the patient consumes?
Alcohol.
Right. You don't want to mix that with barbiturates, right? Not a good cure for anything. All right, then we take a look at school nurse real quickly. We talked about this. Our goal is to treat emergency medical needs in school, teach injury prevention, diminish environmental risks to kids. We think about obesity with our little ones. We think about nicotine with our teens, violence, safety, all these kind of things, right? Does anybody know that the most commonly abused child, what age they are?
That one.
Or if they're
Special needs.
disabled.
Well, it's actually 1-year-olds. Because you know why? They just cry all the time. I mean, not all the time, but they just cry. And there's no way to keep them quiet. They can't talk to you and tell you what's wrong. So you see the highest rate of abuse around 1-year-olds. All right. And ethics and law with nursing. Just know our Nurse Practice Act protects the public. It sets qualifications for us as nurses to what to do state to state. We know that we have ethics and dealing with moral dilemmas. Okay, ethics is a big, huge part of nursing, and I want you to remember that. We worked on some case studies in my class. Hopefully that'll help prep you a little bit. Was there anything on the study guide I didn't cover that you guys are worried about? Nope.
I feel like I'm good with it. Thank you.
Okay, so if you guys have any questions, I'm available by email. My last name is Aloni, A-L-O-N-I. You can look for me in Canvas. If you have any questions about the review, about the test, about anything, you want private tutoring, let me know. I'm available for my students. All your professors should be available for you. I wish you the best of luck. Please remember test taking techniques like don't change your answer. Right?
Yeah.
Okay, you guys know the rules. Good luck to you. Did you have a question, Gabrielle?
Yes, I'm in a different class, but I was wondering, will you be able to pass this recording along to the other professor?
Yes, thank you for bringing that up. I will certainly send this recording to all of your professors.
Okay,
Okay?
thank you.
All right, have a good night. Best of luck on the exam.
Thank you.
Thank you.
Thank you.